Perfect. So we're going to talk about a little bit about Navy healthcare, everything that it's involved and what we've got going on. And then more specifically, we're going to talk a little bit about the medical corps. So Navy healthcare is broken down into 4 different corps. We have the medical corps, which is where all of our doctors are at. We've got our dental corps, which is where we have all of our dentists at. Our nurse corps, which of course you probably guessed it's where all of our nurses are at. And the last one is our medical service corps. So this is where all of our ancillary practitioners practice at. Our pharmacy, our physician's assistant, a lot of our scientists are under the medical service corps. But specific to you is the medical corps. We have over 4,000 active duty and reserve physicians. And you can see all the specialties there that we practice under. So essentially, if there's an area in medicine that interests you and that you want to continue on after your education within med school, the Navy has a spot for you. We're going to talk specifically about the Health Professions Scholarship Program. That's a program that applies to you. It's a phenomenal program. So essentially, it's a full ride scholarship to medical school. The Navy's going to pay every last dime of your tuition. It's a $20,000 sign-on bonus for getting accepted into the scholarship, and they've raised up the pay a little bit. So you see from $2,330 monthly, it's actually around $2,400 a month that you get while you're going through medical school. Now, your only job, go to medical school. The Navy realizes anything that they do to detract from your education would be detrimental. So there's no wearing a uniform, there's no getting a haircut, there's no extra classes that you have to take. You just have to make sure you're focusing on your education and becoming the best physician that you can be. Several different options when it comes to summer break. Number one is they try to get you off to what's called Officer Development School, or ODS. It's 5 weeks long. It's in Newport, Rhode Island. They teach you the basics of what it means to be a naval officer. So it's where we send all of our professionals, our doctors, our dentists, our nurse, our lawyers. They all go there. And it's a little bit about Navy history, how to wear the uniform, that sort of stuff, fully paid for. And like I say, they try to knock that out during one of your summer breaks in med school. That way, when you graduate from med school, you can transition right over into a PGY 1 year without any delay. Now, if there's for some reason you can't get away from school, they're going year round, they're doing step studies, and you want to make sure that you're getting the best you can out of that, no big deal, defer that, push that down the road. And another big opportunity the Navy has to offer is our clerkships that we have. So let's say there's an area in medicine that you are very interested in learning a little bit more about or getting some experience. You really know that you've always wanted to be an orthopedic physician, or you really know that you've always wanted to be an ENT physician. You can do a 45-day, fully paid for clerkship. What I mean by fully paid for is you're essentially paid as an active duty member. So you're getting your full pay, your full salary, and you go in there to learn and practice with our physicians. So let's send you straight to our residency programs. It's a great time to meet with the residents who are currently there, to meet with the attendings, the staff, physicians, and also kind of, I guess, get to know them a little bit if that's the place that you want to apply for and match in. So you can do that during your summer breaks. You can do all of them at ENT if you wanted, or all of them at neurosurgery if you wanted to. If you want to get a little bit of taste of the different areas of medicine, you definitely can do that as well. So while in med school, you've got these great clerkships, you're getting paid to go through med school, don't have to worry about any of your tuition. The Navy's going to cover 100% of that. But what happens after you graduate? So you've got a couple options after you graduate. You can go ahead and do a civilian residency and match into a civilian residency program. You can do our military match, which matches in December. So traditional civilian residency matches in March. We match in December. Or you can defer all together your residency and do what's called a general medical officer tour. I highly recommend general medical officer tours to anybody who has a certain specialty that they know they want to do. I've always wanted to be an orthopedic surgeon. My dad was an orthopedic surgeon. My grandfather was an orthopedic surgeon. I know that's what I want to do. But your step scores or your class ranking maybe isn't where you think that you want to be the most competitive candidate that you can be. You can elect to be what's called a general medical officer. And a general medical officer has several different specialties that they practice in. Undersea medicine is definitely highly sought out for very motivated physicians. They teach you how to scuba dive. They teach you everything about underwater medicine. And essentially, you're the physician for Navy SEALs, EOD dive teams, that sort of stuff. Very competitive program, but definitely, highly sought after by motivators. Operational medicine, essentially you are a family practitioner almost to either sailors or Marines, doing anything from kind of what I was talking about a little bit earlier. So coughs, colds, runny noses, a lot of sports medicine, consults, that sort of stuff. And then the last one, but my personal favorite, is flight medicine. So if you elect to do a GMO tour and you want to go flight medicine, they send you out to Florida. They teach you how to fly airplanes. They teach you how to fly helicopters. They teach you all about the physiology that goes into flying. Then essentially you are the physicians when it comes to aviation medicine, right? So like I said, I just came from an aviation unit, and a good friend of mine was the physician there. His name's Lieutenant Tanner Miller. And one of the things that he said to me always kind of stuck out. So he said that one of his physician mentors told him that there's always time to be a physician, but there's just a little bit of time for adventure. And he said that's why he elected to go GMO tour and become a flight surgeon. So they taught him how to fly helicopters. They taught him how to fly airplanes. He was a flight medicine physician for probably about 18 months. And then he matched in and is currently an ENT resident. So if you're interested in applying for the program and you want to apply for the program, I can definitely get you in touch with Lieutenant Tanner Miller, and he can talk a little bit about his experiences. Grew up in Oklahoma, went to med school in Oklahoma, did the HPSP scholarship. I guess I'll kind of save the rest for him to talk about, but he's really enjoyed it, and probably the best physician that I've served with. So if you're interested in meeting him, definitely let me know. So moving along, let's see if I can get this guy moving. Naval hospitals, what does it look like to serve or to treat, be a physician in the Navy? So a lot of our hospitals look very similar to what you see on the outside. That picture there in the center of Camp Pendleton, a little bit outdated. If you've been down the 5 going towards San Diego, they have a brand new hospital that oversees the ocean, and that's where we see a lot of our patients there from Pendleton. Our biggest hub on the West Coast is going to be Navy Medical Center San Diego. It's our major teaching hospital. So a lot of our residency programs are down there as well. If you were to do one of your clerkships, you probably go through Navy Medical Center San Diego. The patients that we see as Navy medicine, we see a lot of cradle to grave, meaning that as a physician within the Navy, you are going to see not only active duty service members, but you will see their dependents, so their children's. We also see retirees, so you see geriatrics. So kind of wherever you're at in medicine, you're getting a full spectrum of patient load, and not necessarily, the young, healthy adult that you see as the active duty service members. So some of the locations that we have hospitals and clinics at where you could practice, you can see on the screen. I've enjoyed everywhere that I've been stationed. From the West Coast originally, so I tried to stay on the West Coast. I served out in 29 Palms, which I absolutely loved. Anybody who's ever served in 29 Palms, you're close to Vegas, you're close to San Diego, you're close to LA. I used to go jet skiing in Havasu almost every weekend. San Diego, like I said, they've got a big, beautiful hospital there, really great. When it comes to duty stations, Navy's big on water, so a lot of the locations that we have are close to water. I think Lemoore is probably one of our biggest East Coast inlands, right next to Navy Medical Center, Great Lakes. But those are essentially some of the spots that we have inside the U.S. If you like to travel, like I like to travel, I told the Navy, hey, definitely send me over to Europe. We've got several spots that are overseas. We've got hospitals and clinics within Naples, Italy. Sigonella, Sicily is where I served for 3 years. Guam, if you've never been to Guam, it's a beautiful island, American territory. I just got back from Guam probably about 18 months ago. Phenomenal. And we have a big clinic over there in Hawaii as well, which is very nice. I was over there about a year ago as well. All personal stuff traveling, but super enjoyed the overseas locations. So some of the things that we do in Navy medicine, beyond what it sounds like, being on ships, we do a lot of humanitarian missions. Part of the ways that we strengthen up our alliances around the world is providing goodwill to countries. So anything from local disaster support like Hurricane Katrina. I'm sure that you saw in the news The Mercy and the Comfort were both deployed in support of the COVID-19. They took over non-COVID patients to start treating on the hospital ships. In fact, I think they did a pacemaker insert on either the Mercy or the Comfort, and I think that was the first time it was done on a ship. So it was kind of a big thing for the navies to get that taken care of. But so every year, the Mercy or the Comfort, they trade off and they go on humanitarian missions around the world. These hospital ships are fully self-sustaining. They have over 1,000 inpatient beds, huge ICU, several operating rooms. So when they go out and about, they will do anything from fixing cleft palates, just regular old teeth extractions. They will do prescription glasses, getting people eye care. I mean, kind of you name it, we go into these different spots. So most recently, they did a South American tour. So they departed from the East Coast. You can see they went to El Salvador, Colombia, Panama. And essentially what they do is they go out overnight, they pull into a new port. They're there for maybe about a week or two, and they're serving those who need medical support the best. So it kind of works best for both people. We get a lot of expeditionary medicine practice out of it and treating on these ships, as well as making sure that our friends around the world are well maintained and well taken care of. Some of the basic qualifications for service, not only in the Navy, but as far as the scholarship is concerned. So when it says commissioned by age 42, what we're talking about is graduating from medical school prior to your 42nd birthday. U.S. citizen, sole citizen in the United States. If you're seeing this, that means that you've been accepted into med school, and congratulations, that's very awesome. Minimum GPA to apply is a 3.0. They say an MCAT score around 500, but there's always kind of maneuvers left or right for that, depending on where you land at. What you do is you put together an application with myself. I help process all those applications and submit it to a board of senior physicians who oversee all applications submitted nationwide and make a determination based upon the amount of applications that they have, as well as the number of spots they have available in the Navy, who they're going to offer the scholarships to. So some of the internships that you can elect to take after you graduate med school, your PGY 1 year. Let's see if I can push this along. So a lot of them are family medicine or PGY 1 tour. We've got Jacksonville, Florida, Camp Pendleton, Camp Lejeune. All the other kind of PGY 1 years fall into one of the three categories that you see below. It's either going to be in Navy Medical Center, Bethesda, Maryland, Navy Medical Center, Portsmouth, or of course my favorite, Navy Medical Center, San Diego. Major teaching hospital. They've got tons of kind of the cutting edge when it comes to a lot of the things that they're doing there. I could probably talk your ear off for at least another hour on the stuff that they've got going on down at Navy Medical Center, San Diego. But awesome stuff. So these are all places that you can do your PGY 1 tour. Military residencies, we've got tons of subspecialties, specialties and subspecialties that you can match into and apply for. So you do one of these clerkships, you really enjoy what you're doing, you can apply and match into these specialties. The Navy also has many fellowships as well that are available. So if you're going through and you really enjoy cardiology and you kind of want to continue on through that path, you can do that through the military's match program, as well as, you know, kind of transitioning through. Now, some of the positives about doing a military residency: number one, you're getting a top-notch education. The military's general surgery program has had 100% board pass rate. I want to say for about the last 12 years. So everybody who's gone through the Navy's general surgery residency has passed their boards and passed their boards the first time up. It's a great training that they've got going on. Secondly, we've got the highest paid residents. So when you look at a normal PGY 1 who's starting at maybe $45,000, $50,000 a year, the Navy pays a lot more when it comes to that. And on top of that, there's no kind of school debt that you're paying back. Time commitment for the Navy's health profession scholarship programs, 4 years as a practicing physician. Time in residency is what's considered a neutral year, so you don't owe time for that, and it doesn't count towards payback. If your residency is over 4 years, it's a year for your payback after that. So for example, let's say that you were going to do a 7-year residency, it'd be 7 years as a practicing physician after that. And that's kind of a quick down and dirty as far as what Navy medicine is, what we're all about, the benefits of a health profession scholarship program. What I'd like to do is kind of open it up to questions. If there's any questions about anything that I covered today, Navy medicine, definitely please let me know. But, I appreciate the time.
Let's try that again. I'll share just a little bit of our story. So some of you know this and some of you don't know this. My husband is a Navy physician. He went through medical school on an HPSP scholarship. Navy was kind of a no-brainer for him because he was already a Navy veteran at that time. He did 5 years in the Navy before undergrad. He used the GI Bill to pay for undergrad. And then going back in as an officer was like, well, duh, at least for him personally, because he really knew what he was getting himself into. So he did Navy HPSP for medical school. He graduated in 2012, did internship in family medicine at Camp Pendleton, spent 2 years then as a GMO, a general medical officer with the Marines at Camp Pendleton. And I absolutely agree. That was probably his favorite time of his all of his active duty experience was his GMO working with the Marines. He had a blast. Did that for 2 years, and that helped him a lot to become competitive enough to get into the residency program he really wanted, which was radiology. He was accepted into the radiology program at Naval Medical Center San Diego and did that for the next 4 years, graduated from his residency program in 2019, and is now stationed at Naval Air Station Lemoore as the sole radiologist on the entire base, which is a little crazy coming out of a residency program and then immediately going on to being the only one. So that's been an adventure for him. He also deployed on the Mercy for, I think he was gone for about 2 months. He only went for a portion of the deployment because he was in residency at the time. But he got to go to Sri Lanka and Malaysia and had some pretty incredible experiences there as well. So he has all kinds of interesting experience. Those of you who are current students, I've offered him up many times as if any of you want to talk to somebody who's actually done it, he's always happy to talk to folks. So let me know if any of you have any interest in talking to somebody who's actually physically done it. He also, because he's stationed at Lemoore, those of you who are current students, or for those of you who are on your way in next year, he's just right down the road. So if any of you have any interest in visiting the clinic or seeing what his work situation looks like or anything like that, I'm sure he'd be happy to work with folks on that too. So.
Great, awesome, thank you very much. Any general questions for me? I know that was kind of a quick down and dirty for the Health Profession Scholarship Program. We are still accepting applications, so the Navy still has room for students who would like to apply for the scholarship. It doesn't take too long to put together an application. The only thing I really physically need anybody for is to get their physical done. It's a head and toe medical exam up at MEPS that I schedule you for. Doesn't matter if you're local here to Fresno or you're abroad. I recently had somebody physical out of Ohio, so we can coordinate any of those things that you have. But we can get your application rolling and submitted for that. A couple little things that I'd like to dispel that I've heard of recently. Some people said they're a little bit hesitant to apply for the scholarship because they thought if they didn't get selected, they would have to go enlisted. That's not true at all. You're never committed to joining the Navy until after you've been selected for the scholarship and you decide that you want to accept that scholarship. So you can do the whole thing, get accepted for the scholarship and say, $250,000 sounds nice, but I think I'm going to pass. That's completely up to you. At this point, what I really enjoy doing is helping people kind of fulfill their dreams. One of the things that always hold tight with me is how well my recruiter took care of me when I was joining the Navy 18 years ago. And I tried to pay it forward with what happened. So if you're interested, my cell phone number is right next to my head. It's the best way to get in contact with me. My email's up there as well. Feel free to reach out. I can answer any questions that you have. If anybody has any, would like to speak to students who are currently in the program, I can arrange that as well. And if you'd like to talk to Lieutenant Tanner Miller, like I was talking about, great guy, I'm sure he would love to also speak about his experiences.
It looks like Brandon Edwin has a question.
Oh, yes, Mr. Brandon.
Hello, Mr. Sarah, and thank you for being here. My question is, so when you serve as a GMO, does that count towards your active duty obligation afterwards, or does it not count?
Good question. Yeah, it absolutely counts towards your payback as a towards service. So, for example, another flight surgeon that I worked with last time when I was with an aviation unit, he did his payback solely as a GMO, and then he matched into a civilian residency in emergency medicine, got out of the Navy, and went to do a civilian emergency medicine in Florida. So the time that you spend as a GMO absolutely counts towards your payback as well.
Sounds great. And a follow-up. So is there an option? So after we serve as our payback, is there an option to still be like with the Navy, like as a reserve, being a physician?
Absolutely. So once you complete your initial obligation, to do those 4 years, you can transition directly into the reserves. One of the things that the Navy does is if you're coming off of active duty and going into the reserves, what they do is they defer you from any type of deployment for at least 2 years. So that means that once you're done with your active duty time and you're trying to get settled down into your career, you don't have to worry about, oh, the Navy's going to say, I'm going to go do whatever. You can focus on getting set up. And then one of the benefits of being a veteran is you can take advantage of a veteran small business loan. So let's say, for example, you're a family practice physician, you're a dermatologist, and you kind of want to set up your own clinic vice joining some sort of physicians group. You can take advantage of those programs to set up your own clinic and get going yourself. So yes, absolutely. You can transition into the reserves. The reserves have a lot of good bonuses as well. So while we're talking about bonuses, we'll talk a little bit about how that works. So after your 4 years, if you decide to stay Navy, they have what are called retention bonuses. So they could say, look, we'll pay you $250,000 a year to, continue for the next X amount of years. They break that up per year. And they do the same thing with the reserves. So you're serving part-time, and they could say, look, we'll give you $75,000 a year if you agree to serve in the reserves for 3 years, and they pay you $25,000 a year. So you can absolutely go from active duty, transition into the reserves, and then continue on doing your service and building retirement up in the Navy through the reserves. One of the nice things that the Navy just changed is they kind of redid the way that their retirement system works. So it used to be that you do 20 years active duty. Once you retire, you get half your paycheck for the rest of your life, and then you also get medical benefits for the rest of your life. So they made a small change. So now if you do 20 years, you only get 40% of your paycheck for the rest of your life. You still get medical benefits for the rest of your life, but now they do 401k matching. So for example, if you were to only do your 4 years in transition, the Navy will match you up to 6% of your pay into your 401k, so that when you leave the Navy, you're still walking away with a good chunk of money towards your retirement, and you don't have to stay vested for that 20 years to collect your retirement. So,
yeah, thank you, Mr. Cicero.
You're welcome. Any other questions out there I can answer for anybody? Hold on, looks like I just saw a hand up.
Hi, good afternoon.
Hi, how are you?
I'm doing well. I didn't mean to take the floor from Nikita. I apologize, but
oh, no worries.
Justin.
Go ahead.
Thank you, Justin. Thank you, Ms. Millette, for sharing. I appreciate the insight. I had some questions I'd like to ask. Good to see you as well, Dr. Ely. But I had some questions to ask about the benefits as a recipient that you just touched upon. Is there somewhere we could reference as well online, or would you like us to contact you about, some specific questions for some discourse about that?
Yeah, if you have, so if you go to Navy.com, they've got a lot of very general information when it comes towards the scholarship and some of the benefits. As a Navy medicine representative, I can definitely talk to you a little bit more on everybody's individual circumstances, as well as exactly what some of those benefits are So if you have detailed questions that are about, specific individual circumstances that you'd like to talk one-on-one, yeah, hit me up on my cell phone, and that's what I'm here to do. I'm here to take care of answer any questions that you have.
Appreciate it. Thank you so much. We'll do.
Yeah, not a problem. All right, Nikita.
Hi, Mr. Tercero. Thank you so much for a wonderful presentation. I had a quick question about the whole application process.
Yes.
So how quick would the turnaround be once we submit the application? Just to get a sense of the timeline moving forward.
Sure. Once you submit your application, so they hold boards monthly. So the application, how long it takes to put together an application depends on the individual student. Sometimes we can get applications done within a week or two. Sometimes it takes a little bit longer to get all the required documents back, and it takes a little bit longer. Once we have your application complete, it gets submitted out to Big Navy, to the next available board. The deadline for that month's board is the 11th of that month. So tomorrow would be the deadline for this month's board, and then the 11th of April would be the deadline for next month's board. Boards meet, like I said, once a month, and typically it takes a couple weeks for results to come back. Depending on where you are with your education is how quickly after that we can get you to sign a contract and start receiving benefits. Sometimes it takes a little bit longer for what's called final selection, if there's anything that they're still waiting for. But typically it'll take probably about a month or two from start to finish, again, depending on how long it takes to get all the required documents together.
Sounds great. Thank you so much.
Welcome. Zach, I see that you're on the line. Do you want to add anything about what your experience is like so far in the program?
Yeah, sure. I think, so I'm a first year, so I haven't done officer training yet. We're still waiting on that. There's a bit of a backlog for officer training just because of COVID, but I don't think you guys are gonna really experience that as you go into it. I think it's been pretty good. I mean, in terms of being in like what the Navy expects of me, it's very much like HM1 said, that they're very hands off. They're letting me do my education and focus on medical school. So I think as I, go through it and go through training, and I'll have more perspective. But so far, I think it's been a great decision. I'm happy with the decision I made.
Awesome. Thanks, Zach. I appreciate it. Sure. I think it's been in a straight through transition for a while. So what we're seeing is a lot of the positions that GMOs were currently filling are getting filled by mid-levels. So a lot of physician's assistants are filling those positions. And the Navy is also looking a lot through moving straight through. So meaning that you would go to med school, you'd match in, you do your residency, let's say you do family practice, and then they have certain leadership billets or leadership locations that you can get stationed to as a residency trained physician. So we'll just say, for example, as a family practice physician, residency trained, you could be overseeing several physician's assistants who are taking care of some of the units within their charge. So the Navy has been in kind of that move for a while to go away from GMO tours because some people find them unattractive. Like I said, it's any person that I've ever talked to who was a GMO has nothing but positive things to ever say about their GMO tour. But I think that's kind of the way the Navy is moving, is going through that straight through. Now, I've heard that the vision was within the next 5 years to be a completely straight through program. So that could be something that's coming down the pipeline. Right now, we still have GMO tours that are available. You're welcome. Right. Well, if there's no more questions, again, my name is Petty Officer Justin Tercero, the Navy Medicine representative. My office is in Fresno, but I cover kind of all over the place. If you have any detailed questions that you'd like to get into, my contact information is up there. Let's see if I can move my head a little bit. If anybody needs to take a screenshot or write that stuff down. I can answer any questions that you have. If you feel like you want to start working on an application, definitely let me know. I can help you walk through those processes as well. I appreciate everybody's time for tuning in. Thank you very much, everybody, for setting this up for me. And hope everybody has a great day.
Thanks so much, Petty Officer Tercero. We really appreciate your time.
Absolutely. Can't wait to get back into school and see everybody.
Absolutely.
Thank you.
Oh my goodness. We can't wait to welcome visitors again. Oh my goodness. We can't wait to have us back again.
I'm sure.
Soon. Fingers crossed.
All right.
Thanks so much, everybody.
See ya.
Take care.